We interrupt regular programming to bring you a message from Her Majesty's government. Please stand by and await further information.
Good evening. The coronavirus is the biggest threat this country has faced for decades, and this country is not alone. All over the world, we're seeing the devastating impact of this invisible killer.
This is the Wartime Broadcasting Service. This country has been attacked with nuclear weapons. The number of casualties and the extent of the damage are not yet known. Stay tuned to this wavelength, stay calm, and stay in your own homes.
Now, at an individual level, the chance of anybody watching this dying of coronavirus are actually low. Over the whole epidemic, even if we have no vaccine, a high proportion of people will not get this. Of those who do get it, a significant proportion, the exact number is not yet clear, but it's certainly a significant proportion, have no symptoms at all. They get it without even realizing it. Of those who do get symptoms, the great majority, probably around 80%, depends on number of factors we'll go on to, have a mild or moderate disease, which is sufficient that they would want to go to bed and feel unwell in some cases. Some cases they can actually just carry on doing their ordinary activity, although we ask them not to, but they don't actually need to go to the doctor or medical services, and they make a full recovery. A minority have to go to hospital, but most of these actually, the principal thing they need is oxygen, and the great majority of those will go on just to survive. And then a minority have very severe disease, may need ventilation, and of those, some sadly die with current treatment. But, important to stress, even in the most high-risk group, the majority of people who actually get this infection do not die.
A 1 megaton bomb exploded 7,000 feet above the House of Commons would create a fireball over a mile across, over Piccadilly Circus, Trafalgar Square, the very heart of London. The fireball would last for approximately 10 seconds, reaching inside it temperatures of hundreds of thousands of degrees centigrade. Over an area for about a mile down as far as Vauxhall Bridge, there'd be winds of 700 miles an hour. And while some of the more substantial buildings might be left partially standing, they'd have shifted on their foundations. Anything else, any human beings, would have simply vanished. Over the entire centre of London, Oxford Street, Park Lane, Mayfair, Kensington, Camden Town, up as far as the borders of Hampstead, down here on the river over Chelsea and Fulham, because of the intense change in pressure, houses would simply explode, people would disappear. The blast would reach Battersea Bridge within 11 seconds with winds of 180 miles an hour. Out as far as 7 miles, that's down through Putney, Hammersmith, Barnes, as far as Kew Bridge. Houses would have their roofs ripped off, doors and windows would be blown in, anybody caught in the open would be blown over, their body covered with blistering second-degree burns.
Once more, we must all stay home. If it is essential to go out, remember, wash your hands, cover your face indoors, and keep your distance from others.
You are better off in your own home. Stay there.
Today we launch NHS Volunteers. We're seeking 250,000 volunteers, people in good health, to help the NHS for shopping and for delivery of medicines, and to support those who are shielded to protect their own health.
These Royal Observer Corps volunteers are trained to monitor nuclear bursts and radioactive fallout. But more volunteers are needed. A few hours a month, that's all. You could help to save millions of lives. So why not join? Write to this address.
From this evening, I must give the British people a very simple instruction. You must stay at home.
But for now, you must all stay home, protect the NHS, save lives.
For now, the only way to protect yourself and your family from this disease is to stay at home.
Celebrate the new year in your own home, only with your own household.
Everyone in Wales will be required to stay at home.
The most widespread danger from nuclear explosions is fallout. So you are just as safe in your own home area as anywhere else. In fact, you are far better off at home because it is the place you know and where you are known. So, stay where you are. You are better off in your own home. Stay there.
This is the Wartime Broadcasting Service. Stay tuned to this wavelength, stay calm, and stay in your own homes.
Now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel.
Similarly, following the announcements from the First Minister on Saturday, there can be no doubt that other than for essential journeys, people should not be travelling between Scotland and other parts of the UK. Public safety, public health requires that. Additionally, travel restrictions between local authority areas continue to apply, and from Boxing Day they will be increased to a blanket travel ban right across the whole of mainland Scotland.
A full list of designated essential service routes is posted outside your local authority headquarters.
The first two new emergency powers bills provide for controls on transport and movement by the public, at a time when many people could desperately be trying to move to areas they thought safer. The laws are intended to control not just panic, but dissent as well.
We're trying to get across to relatives in Lincoln.
Not this way, you're not. Essential service is only this road. You have to find another route, I'm afraid.
Well, that's bloody ridiculous. You can't just stop people like that.
Essential service routes include major trunk roads through almost every British city. The name's recently changed, and now it's just effective traffic management. The government may not close roads completely, but police are still told to keep refugees off.
That way you go home and sit tight. That's what they're advising people to do.
Threads is fiction, but plans to keep motorways free for priority military operations are fact. Much of the urban population had been penned in and forced to stay put, with little hope of escape.
Entire families must self-isolate for 14 days if just one member has a persistent new cough or a high temperature.
If you or anyone in your household has one of those two symptoms, then you should stay at home for 14 days.
Passengers arriving in the UK by plane, ferry or train will need to self-isolate for 14 days and fill out a form to say where they plan to stay. Breaching the rules could lead to £1,000 fines, with spot checks carried out by public health officials.
Anybody staying within reach of fallout for too long can fall ill or die. So you must keep away from fallout until it is safe. And this may mean staying in your fallout room for up to 14 days.
First, Mr. Speaker, we're setting up a new system of hotel quarantine for UK and Irish residents who've been in red list countries in the last 10 days. In short, this means that any returning residents from these countries will have to quarantine in an assigned hotel room for 10 days from the time of arrival. Before they travel, they'll have to book through an online platform and pay for a quarantine package costing £1,750 for an individual travelling alone, which includes the hotel, transport and testing. This booking system will go live on Thursday, when we'll also publish the full detailed guidance. Passengers will only be able to enter the UK through a small number of ports that currently account for the vast majority of passenger arrivals. When they arrive, they'll be escorted to a designated hotel, which will be closed to guests who aren't quarantining for 10 days or for longer if they test positive for COVID-19 during their stay. We're also coming down hard on people who provide false information on the passenger locator form. Anyone who lies on the passenger locator form and tries to conceal that they've been in a country on the red list in the 10 days before arrival here will face a prison sentence of up to 10 years.
Members of some army units have already been trained to run internment camps.
It did actually quite shock me to quite a large extent, because I'd never ever realised that was the type of thing that the TA was going to be used for.
If you don't follow the rules, the police will have the powers to enforce them, including through fines and dispersing gatherings.
We stepped things up here because we've given the public 3 weeks to get used to this. This is a massive change in terms of their lifestyle and how they can operate. We've worked on the basis of engagements and information, and from today I'm being really clear that if people continue to flout the law, that they will be fined, and if appropriate they will be arrested.
I announced yesterday to authorise a doubling of our operational presence on the roads in the border country, as well as an increase in patrols across the whole of Scotland. A single national force, we are able to quickly flex resources and provide the presence required. Highly visible patrols, proactively deployed on our networks, will deter people who might be considering breaching the travel restrictions.
I think, David, there are very clear reasons why you should be out of your home. Michelle has listed them today, and if people are going out for another reason, then the police have our full support in turning those people around or taking whatever action they think is appropriate and proportionate at that particular point in time.
But who'll take charge in these special areas? In a crisis, boundaries between police and military responsibilities could get a little blurred. Should they be controlled by civil police or soldiers? If so, British or American? Officially, British laws and British police are in sole charge at all times. They should normally enforce the emergency laws. That's called the primacy of the police.
Cancelled. We were expecting last time that other NHS activity would continue to a certain extent, and for whatever reason it didn't happen.
But therefore there will be a period, the beginning and middle and end to this. Before it, people will see no major impact on the NHS, some reconfiguration, and after it, the NHS will be back to its normal state. But there'll be a period in the middle, if this goes to the top end of the range, and it may well not, but if it does, where the NHS has huge pressure on it for a relatively short period of time. Clearly there will be some life-saving treatment where that will not be possible, and we'll just have to carry on in the middle. But very large numbers of things can in reality be flexed either way with relatively little impact on people's health. It doesn't mean they won't be worried about it, and I fully understand the distress and things, but in terms of actual impact on physical health in the long run, the impact for many people will be relatively small.
Lara is a dedicated mum. A year ago, doctors found she had stage 3 wound cancer, and she had surgery and aggressive radiation treatment. In late January, she was told the cancer had gone, but there's a 1 in 3 chance of it coming back, and she'll need a physical examination every 3 months. She's still waiting, though, for that to happen.
I just think that if it could be caught early, then I have more chance of having a longer with my children. And I feel that by these now phone appointments with my oncologist, there's absolutely no chance that the cancer is ever going to be detected at an early stage, and therefore potentially my life expectancy is shortening every day that this carries on.
Coronavirus has put a huge strain on cancer services. Many treatments, tests and screening were paused as staff were diverted to deal with COVID and because of safety concerns.
And in a crisis, patients in civilian hospitals would just be sent home.
The effect on civilian hospital care is this, that the big infirmaries would be basically dealing with military casualties and would not be dealing with civilian ordinary type of illnesses that they're normally dealing with at present time.
Finally, I can announce today that we will next week open a new hospital, a temporary hospital, the NHS Nightingale Hospital at the Excel Centre in London. The NHS Nightingale Hospital will comprise 2 wards, each of 2,000 people. With the help of the military and with NHS clinicians, we will make sure that we have the capacity that we need so that everyone can get the support they need.
From blank sheet to fully operational hospital in less than a fortnight. A 21st century global pandemic requires an unprecedented response, and the NHS Nightingale is just that.
We take our resources from NHS London and we want to be coordinated from the centre so that they know the best places to deploy staff and deploy resources. At that point, we'll be ready to receive the equipment, the staff and then the patients at scale and at pace at the same standard as occurring back in the NHS.
The language used by the Prime Minister and his aides is martial. Talk of battle lines being drawn. So it's right the military was asked to deliver this logistical and engineering masterclass.
Burtonwood US Army Base near Warrington. Not just a warehouse, but the biggest warehouse in Britain, holding stocks to equip entire army divisions. Amongst the Burtonwood stockpile are 2 prefabricated 1,000-bed mobile hospitals for the US Army. Inside acres of wooden crates are all the parts needed to assemble them. But to put the hospital kits together, Britain has to provide, according to official US information, 182 railroad cars, 28 trailers, and 490 skilled workers. It will be local people who'll be told to do that work. The mobile hospitals are part of a bigger plan to make Britain a US medical base. Other hospitals would be provided by the Americans themselves. One of 3 such hospitals in Scotland is at Arbroath on the east coast. The US Navy will build its own 1,500-bed reserve hospital there. This old Gloucestershire airfield now accommodates one of a network of such US military reserve hospitals.
With coronavirus growing, on Friday we put out the call asking recently retired doctors, nurses, other health professionals to come back to the NHS to help in this unprecedented crisis. I'm delighted that in the first 48 hours, 4,000 nurses and 500 doctors have already signed up.
Well, this morning we're asking officers who've retired in the last 5 years to consider coming back to help us. Obviously the city and the country are facing the most challenging of times. We want to maintain our resilience in the coming weeks, and I know so many officers who've retired who've said they'd like to help.
I normally work in the leisure centre. I'm normally a fitness leader.
Zoe now makes up some of the staff in intensive care. With double the number of critically ill patients, the hospitals had no choice but to call in volunteers to help.
You're totally out of your comfort zone, aren't you? I am. What made you volunteer to do this? I know the help that's needed here, and when they gave me the opportunity to do it, I just jumped at it.
And it's not just council workers. Some staff here are now army personnel.
We've heard of staff being redeployed from other areas of hospitals, but this one has brought in 18 army medics to help them out. Along with the volunteers, they are doing everything they can to keep their patients safe and well cared for.
The plans also cover conscript labour. Thousands of people with many different skills would be needed.
You understand that it includes not only government support in the form of police and fire and border patrol and customs, etc., but it includes a wide variety of civilian support. The assumption is that the civilian population is going to be available and ready to support primarily a military operation.
These are some of the skills listed and required.
You may have a very good job in London working at the stock exchange or at, what's the big department store? Harrods, and suddenly find yourself in a work battalion assigned to the docks or assigned to an airport as a cargo handler. There's going to be requisition of labor probably as early as reinforced alert and certainly uniformly applied in general alert or conditions of war.
The employment department's already made plans to identify those with the necessary skills. Kenneth Clark, Paymaster General, said,
"As part of the arrangement, the United Kingdom has agreed to take steps to try to ensure that their requirements for civilian manpower support are met. Detailed planning and support of the arrangement is classified.